Seeds of Healing is an HIV awareness and advocacy organization whose mission is to deconstruct myths that perpetuate HIV stigma and generate support for marginalized people living with or affected by HIV. Before the webinar begins, please welcome our speaker today. Dr. Foreman received her Doctor of Medicine degree and completed her residency in family medicine at Eastern Virginia Medical School in Norfolk, Virginia, and has held various leadership positions over the years, but is most proud of commissioning in the United States Navy Reserve. Dr. Foreman understands that the health of an individual extends beyond the walls of a clinic or hospital and founded Beyond Clinic Walls Wellness, a health coaching and health education business with the purpose of reminding people that with practical and substantial lifestyle changes, we can all be healthy. Without further ado, I will turn it over to Dr. Foreman.
Thank you, Christian. I'm excited to be here. This is actually my second appearance with Seeds of Healing, and so I am honored that you all invited me back. And the conversation tonight is about preventative health, and I like to include that in the holistic living conversation. And certainly, I could have created a traditional slide deck to kind of walk through some of the preventative health measures that I would recommend. And we will talk a little bit about that. But I also want to put things in context, right? Because, the perspective, and Christian just shared a little bit about my background, but I've done 7 years of higher education. And then 3 years of residency. So that's my training specifically in family medicine. And then I also commissioned into the Navy Reserve and certainly have seen countless patients, not only in my community career here, but also in the Navy. But the one thing that I like to remind people is that there's no level of education and knowledge that can shield you from health challenges, right? I'm human just like all of you. So all of the recommendations that I'll talk about and all of the things that we'll discuss are some of the same things that I have to say to myself. So remember, whenever you're in the healthcare space, that we're not different. There's a level playing field, and that's why we have to have these conversations to acknowledge that. And this is actually one of my favorite conversations because literally at least 3 times a day, there is a 40 to 50 something year old person that when I walk into the door to see them, they say, Dr. Foreman, I am falling apart. You have to help me. And, I'll crack a little bit of a joke because I'll turn 39 next month, actually. And so I'll joke and say, wait, slow down, don't scare me now. Like I'm right behind you in age. But of course, then I go in to ask them, well, what specifically is going on, right? And most often, there is some new symptom that they're experiencing. They're frustrated about a medication that might have been prescribed either by myself or another provider, or it could be that they're a little nervous about family medical history, and it makes them think about the fact that they won't be here forever, right? The purpose of the visit is I want to do everything that I can to make sure that I live as long as I can. But then when that conversation starts, I challenge that because you might imagine it's one thing to live a long life. It's a different thing to live a long and healthy life. And all of our goals should be to not just live long, but to live well. And the way to do that and have a high functioning life is to focus on holistic living. And a way that I like to break that down in a way that many of us can identify with is to liken the conversation to having a beautiful luxury car. So, we're all in different stages and yes, I'm a doctor, but I promise you, I am nowhere close to rich. These student loans are crazy. I'm actually about to become a mom in about a month and a half. So I have some real bills, but we can all still imagine if we don't already have it. Let me not sleep on anybody that might be on the call, but we can imagine how we would feel with a luxury car, right? So when you have this luxury car and you look at this picture, the car is sleek. We know that it's powerful, it can move fast, and dare I say, some people consider cars like this sexy, right? And when you're dealing with a machine like this, you want to treat it well, right? So you may have this luxury car, but you keep your, 2010 car that has however many miles on it to ride around town. And this particular car, you might open up on the highway every now and again, but you prefer to be gentle with it because the car is important to you, right? You take it for all of its regular maintenance. You don't let your children or grandchildren, nieces, nephews, whoever, eat French fries in the back seat because you don't want any grease on the buttery leather interior. This car is really like a pet without a pulse, right? You treat it well and give it a good life, and it makes you happy, right? And just like this fancy sports car, this powerful machine, our bodies can be likened to them. Well-oiled machine, if you take good care of your body, you can do amazing things. But the truth of the matter is, we are not machines. So we have to remember that we are living, breathing, dynamic beings. We have physical, mental, and emotional needs that have to be addressed, and this is holistic, must be addressed holistically. And that's when we include all aspects of our being, not just the physical health, not just the mental health, but the totality of what all of those things mean. And when you take it a step further, holistic living and preventative health is not simply about addressing symptoms that you might have, but it's looking at the underlying causes of diseases and different illnesses and promoting overall well-being and trying to prevent those things from happening. And because our mental, physical, and spiritual health is all interconnected, that's why I include holistic living in the preventive health conversation. And so the truth is, though, even though we know some of these things, right? We know that it's important to live holistically, and we live in a modern society where there are so many new technologies. I mean, even when I think about what life was like when I was in college versus now, it's changed so much. We still treat our bodies a lot worse than we treat our vehicles sometimes, right? We give our bodies less respect than we give the cars that we drive. We'll take our car to get an oil change, but then miss our own annual physical exam, for example. And we push ourselves to the limit, and we don't take a pause to think about how we're treating ourselves until our so-called check engine light comes on, right? That's when something goes wrong or we literally break down and have an issue. And I argue that we need to stop that. But it's hard for us to sometimes understand what holistic living looks like in practice. And so I'm going to keep going with this analogy with the car because I think it will drive home again for most of us, because you have to do these things regularly to keep the car running smoothly, just like we have to do things for our health regularly to keep our bodies in optimal function. And so I actually would like to start with the car's major fluids. So certainly it's not something I necessarily think about on a regular basis myself. I know some of the maintenance that needs to be done, and I kind of let those people do their jobs, right? Just like I do my job when patients walk into my office, but I think we can imagine that there are some fluids in the car that are important. Things that come to mind is the engine oil, transmission fluid, radiator fluid, and of course, we need gas for most cars to power it, and in some instances, electric. And you can actually liken those fluids to the types of foods that we take in. And so it's analogous to our dietary habits. So the food and beverages that we take in and the variety in which we consume them ensures that we're getting the proper nutrients. Just like different cars need special octane gas, different bodies or different people might operate on different more they might operate more optimally on certain food habits, right? And so if we don't do this and there's place for fun foods, like you see this picture on the screen. No one says you have to eat fruits and vegetables, be a vegetarian, pescatarian, vegan, anything like that. But we should also remember that we cannot overindulge in things like pizza and fries because if we do that, we are going to burn out. It's like having the wrong oil or the wrong gas, and it will leave you feeling sluggish and sometimes worse, right? You can develop different things like diabetes or hypertension that certainly can be more challenging to get rid of than just changing your food in the moment. You have to do these things on a regular basis. And then if we take that conversation a little further, we have to acknowledge that it's not just as simple as the foods we eat, right? And this particular shift in the conversation is fun for me because it brings me back to my teenage days of first starting to drive. And I'm from Maryland originally. And Maryland is one of those weird states where it's not quite the north, but it's not quite the south. So we do get snow, as you see in this picture, but we're still not necessarily readily equipped. We're not a Philadelphia, we're not a New York, we're um we're not a Boston, right? Or Massachusetts if we're talking states. And when I was driving as a teenager, and going to school and such, there was this one moment in which I slid on black ice. And I got home and I talked to my dad about it. And in that conversation, he walked me outside and we started to talk about tire tread. This was something I knew you have to replace tires at some point, but it wasn't necessarily on my radar because, from my perspective, as long as I could get from point A to point B all in one piece, I wasn't really thinking about it. And, truth be told, no one has an answer for black ice. However, that particular situation highlighted the need to pay attention to this particular maintenance item. We can't negate some of the smaller items just because we don't readily see an issue with them. And that reminded me of how it is that we manage our bone and muscle health, right? Because oftentimes we're not thinking about what it is that our back and our legs and our arms and our abdominal muscles are doing for us every day until there's some sort of a secondary problem, right? As long as we're getting to work and we're taking care of our family, we're happy to continue to do so until something happens, right? Until you start to feel that knee pain or you start to feel that back pain or you pull your muscle trying to put your bra on or tie your shoes, right? So we skip exercise, we don't stretch. And if we do, sometimes we just do the similar things or the same things over and over and don't have variation in our exercise, which can also make us more prone to injury as well. And you realize that, okay, we are going down a path of physical burnout in a different way. So, yes, maybe we're eating well and we're tackling that, but then we're not moving our body and stretching those things to maintain our muscle and bone health. And the truth of it is that regular exercise is also important because it can help us tackle some of those other medical conditions like high cholesterol. So, regular physical exercise, especially cardio or cardiovascular activity, is an amazing way to decrease blood pressure if you do it consistently. It's also an amazing way to manage insulin resistance or keep your blood sugar more steady. And it can improve cholesterol. It can improve how you sleep, and it can even improve your mood. So it's the way that we often have people manage depressive symptoms or anxiety symptoms. And it doesn't have to be something organized. So no one says that you have to sign up for CrossFit or do crazy classes, but just making a decision to move your body on a consistent basis is best. That's all you have to do. And the fact that you also feel better after makes it a win-win situation. So it's important to incorporate that. And then even as a community, the more we do together, we uplift each other. Many of us are parents. If we're not parents, we're aunts or uncles, things like that. And we want to be our best selves, and we do that by tending to all of these things. But then, we're talking about some of the more, I would say, perhaps obvious things. We know about the best things to eat, even if we don't always practice it, right? And we know that we should exercise, even if, again, we're too tired sometimes to do it. But what about our brain? And so the analogy to the brain for a car is actually the engine control unit. And so that picture itself is an engine. And actually, as I developed this talk, because I'm not a mechanic, right? So I had to look into this a little bit. But the engine control unit helps with basic functions, four basic functions actually, which is input, processing, output, and power management. And when I read that, I said, oh, that's exactly what the brain does. So the engine control unit is making sure that the car is properly taking in information from the environment, um itself, so what is happening in the car itself, and then it's responding by engaging the system to provide the car with what it needs in the moment, right? And that's what our brain does even if we don't recognize it, right? So we have different sensory units. Our eyes and ears are very common ones that we know. Being able to see helps with that, right? Being able to hear helps with that. And when we can't do those things, we adapt and we learn other ways like vibration, etc. Us being able to feel is another way for our brain to take in information. But if we don't care for our brain and do things that promote brain health, then it's difficult to communicate with the world around us. And truth is, you can replace an engine on a car, but we cannot replace our brains. Our science has not gotten that far. And so we have to be aware of that because we only have one brain and we have to treat it well today. And that means avoiding trauma, so that's why the conversations around brain injuries in contact sports have become more popular or commonplace to discuss. Because if you're getting repetitive brain injuries, that's going to change how you function, right? Recreational drug use impacts that. Excessive amounts of alcohol, because listen, when this baby comes out, I'm gonna have me a drink now, but you can't overdo it, right? It's important to keep all of these things in balance to optimally manage our health. And once you understand that, and that the brain is the control unit, and of course, we often interconnect the brain and the heart as well, but reducing stress, cultivating meaningful relationships, engaging in activities that bring you joy. all of this is going to positively impact your health and make it easier for you to not only live a long life, but a fulfilling life. And that's why we're here today, right? Because an important part of preventative care is understanding that knowledge is power. We come together to have these conversations and gather that information so we can use it to positively impact our personal health. And certainly, I love Google as much as the next person, but when it comes to medical concerns, simply Googling is not enough. Google is a good first step to learning more, understanding things better, but then using that as a springboard to have conversations with your healthcare providers because the truth is that Google doesn't provide context. So Google does not know you. Google does not know your lab results, and Google, quite frankly, doesn't have your best interest at heart, right? Because we all have had that moment where we went on Google to check something simple and like toe pain, and they tell us we got cancer, right? And so if you do that regularly, it can cause a bit more harm than good. So keep that in mind. That's why I love platforms like this so we can have one-on-one conversations about the things that we need to do. Because those of you who are on this call are showing signs that you are and you want to remain high functioning individuals. You want to seek out the information that is going to positively impact not only your life, but the lives of people around you. And by gaining this knowledge and sharing experiences, we make each other stronger and plant the seeds for a positive future for those who come behind us, right? And so, I said I didn't want to do death by PowerPoint, but of course, I have to share some information about the resources that we have specifically in this area that can help you. But before I do that, let me see if there are any questions. Nope, they were just greetings. But if anyone has questions or thoughts as things go along, please do drop it in the chat. But I'll move forward with having more of the conversations. Now, I think I might have gotten a little ahead of myself. I know that Seeds of Healing works with people of all backgrounds, but if I'm not mistaken, I'm aware that it seems to be a little bit more women than men. And so I wanted to make sure that I emphasize this. And perhaps also there is a women's health uh meeting or a conference that's coming up this weekend, actually. And so if you had not heard about that, I'm sure LaShonda, you might know. I'm like stumbling on my words a little bit. I won't be able to make it, but I know that's happening. And so no matter who you are, man, woman, or child, it's important to have an annual physical, especially as we get older. And so it's funny, again, just, shared experiences. When I think about growing up, my mom said, "Oh, you're going to go once a year because I pay for this insurance and they cover a physical once a year. So if you are a person that pays for your insurance out of your paycheck or even out of pocket yourself, make sure that you are maximizing the benefits that your insurance provides for you." Right? Because you won't get that money back at the end of the year if you don't go for that appointment. And when we're doing these appointments, that's when we're having conversations about what is up and coming for your age group. And for me as a provider, when I'm doing a physical, I'm usually screening for anemia. I'm looking at blood sugar, cholesterol, your kidney function, your liver function. For many people, I'm also looking at thyroid function as well. And then based on any specific concerns you have, I might add on additional labs. And so you see, and then also vital signs. So if you don't go to the doctor regularly and have your blood pressure checked at least once a year, you can have high blood pressure and not even know it. So that's important. And you'll see when you're around 19 plus, that's when you start to go a little bit more regularly. If a person doesn't come every year, I usually don't press them that hard. But once you start to hit those 30s and 40s, I'm a bit more adamant about once a year. There are a few rare cases where you can squeak by without, but certainly 65 plus, you should be going once a year. And so, again, when it comes to heart health, we're thinking about blood pressure and cholesterol. Cholesterol can clog the arteries and make it harder for the heart to get oxygen. And so that's specifically labs because high blood pressure is called the silent killer. So you can walk around with no symptoms and have high blood pressure. Now, some people do have symptoms, but many people do not. So that's something to be mindful of. And then blood sugar monitoring, that can also impact your heart health because when the blood sugar is high, it attacks the vessels and the nerves. And so we use blood sugar as well as the A1C. So blood sugar is usually taken in the moment. So if I pricked your finger or drew labs now, it's telling me exactly what your blood sugar is now. But a hemoglobin A1C, you can't hide from because that tells us what's happened over the course of about 3 months. So that particular lab you don't have to fast for. And neither do you have with the glucose. We just how we interpret the labs is based on if you were fasting or not. So keep that in mind and don't get too nervous when you're going to the doctor's office to have those conversations. And then for women, mammograms, the older you are, the less often you have to go. And that's breast cancer screening. Sometimes people ask questions about ultrasounds, specifically MRIs, and then there's some other modalities, but currently mammogram is what we call the gold standard. So it's the primary way that we screen people for um, breast cancer. And then cervical cancer screening, that's a pap smear when we're younger. It's every 3 years. I remind people that cervical cancer screening is similar to colon cancer screening, right? So it has a schedule. Now, certainly, if you have pelvic issues, vaginal discharge, pelvic pain, vaginal pain, etc., you should talk to your primary care provider or your gynecologist. But specifically, cervical cancer screening is based on your age and personal medical history. So 3 to 5 years if it's normal, and it could be more often if there's something going on. Colon cancer screening, we have options there. So I encourage people to get at least one colonoscopy because if it's totally normal, it's every 10 years. So even though people shy away from colonoscopies because of the prep that you have to do and the fact that it's more invasive, if it's normal, then you're good to go and you don't have to think about it again. The current standard is starting at 45 years old for that. It used to be 50. So keep that in mind if you're on the call and you are 45, between 45 and 50 and have never had any colon cancer screening, I would get that checked out. And then certainly reproductive health depends on age. And then if we're talking men, you would add in a PSA, which stands for prostate specific antigen. That is what we track to monitor prostate inflammation and any changes that can be indicative of prostate cancer. So men would get all of these things plus, well, minus cervical cancer screening and mammograms, and then you would add in prostate cancer screening. And of course, there are special situations where your gender identity might change how we approach these things, but it's based on organ status at birth, unless you get hysterectomies, etc. And so now it's a question of, well, where do we get access to some of these things? And the Health and Human Services Department here has some opportunities for that. And so as you see, you can get PAP and HPV. Oftentimes we are testing for HPV at the same time, or we always, at a certain age, test for HPV with the pap test, but if there are abnormal cells, the labs will automatically check HPV to make sure that that's not the case. Mammograms and also some medical consultations. Certainly, there are some criteria for accessing that, but that is a phenomenal opportunity. Planned Parenthood is an option as well that goes beyond gender identity. And as you can see, it's a wealth of opportunities when you go to the Planned Parenthood. And certainly in 2025, a lot of things have been put on attack. However, we should all be bold and realize that everyone deserves adequate care. And wherever you can seek that at a a cost-effective manner is the way to do it. But you see, they even help with smoking cessation, which I didn't get into as much, but feeds into the things that we put in our body, diabetes screening, thyroid screening. So that's a phenomenal option. And they work with insurance and without and do a sliding scale for their services. And then specifically for colon cancer screening, I thought it was a good idea to share what that out of pocket cost might look like for people. Everyone does not have insurance, but there are options. So if you're doing the blood test, that is what you would do once a year. It's not as specific as the other tests, but as you can see, in at some places, you can get it for about $100, and for a once a year investment for your health might not be so bad. Okay. Cologuard is between $500 and $600 without insurance. But again, that's an investment that as long as it's negative, you do every 3 years. If a Cologuard is positive, then we highly recommend a colonoscopy. And as you see, the range and cost for that varies. And so that's why I thought it was important to talk about the other options because I'd rather you do the stool blood testing or a Cologuard versus not have any screening at all. So please do keep that in mind. And so with that, we knocked out the main items, and I would love any questions. I'm not sure if they've come in, if there's a chat that I can't see, or even just comments that you might have, any shared experiences that people might want to put out there. I would love to hear. So the question was, tell us more about Planned Parenthood services. Tell me more what you mean by that. Because certainly I wouldn't have intimate knowledge since I don't work there. But yes, all genders. Yes. So you don't have to be a woman, you don't have to be a male. The fees are on a sliding scale. So it depends on your financial situation. And they do also accept insurance. So if you have insurance and you want to utilize Planned Parenthood, for sometimes going to Planned Parenthood might be more convenient. You can make appointments online at Planned Parenthood also. So it could just be, I want this, no referral needed for Planned Parenthood, not at all. So you would just go online and you can make an appointment. Um, and if there are financial concerns, then it's a sliding scale situation where they set up payment plans, etc. And then it also depends on the type of service you need. So, for example, if you're going because you're concerned about urinary symptoms, for example, that fee would be different than if you went because you want an annual physical and have a battery of labs completed. So a lot of it depends on what you're going there for. But yes, and I think that's one of the frustrations that I have with some of the discrimination against Planned Parenthood because Planned Parenthood isn't just about abortions, right? People really get quality, comprehensive care at Planned Parenthood. And so I hate to see some of what happens, but also whether it's an abortion or annual physical, that's all our own business. And it's not fun to see people get involved with things, irregardless of how you feel. People have to manage their personal lives the way they see fit. And I just want people to be safe and healthy. Um, you're welcome. And something else I would encourage while we're waiting to see if people have questions is whether you're going to your primary care doctor or you're speaking to a specialist that you might work with, do your best to appropriately challenge the things that they discuss with you because again, we're all human and it's important to keep that in perspective. But, sometimes the answer of because I said so isn't necessarily the right thing. Um, your physicians or other healthcare providers are not your parents. And so it should always be a collaborative conversation. Um, so dietitian services can be a little bit more difficult. So there was a question about our nutrition services available in the community. So traditional nutrition services where you might have one-on-one access to a dietitian to my understanding, are not readily available here in Wilmington for a reasonable price. Some dietitians, for example, don't accept insurance at all, so you have to keep that in mind. So, from a cost standpoint, if you can afford that, that's phenomenal. But there are options to learn more, but it not might not necessarily be one-on-one. I don't have an exhaustive list of those options, but I know, for example, UNCW has options for um, like food as medicine type classes, as well as Novant sponsoring some events throughout the year that focus specifically on nutrition. They actually also have a program for food as medicine where if you qualify based on your income, that you can get vouchers for um, a type of community garden setup where you can get fresh produce. They're still working on getting that more of a robust program, but it's exciting that they're thinking outside of the box to help people with food access. And so, yes, again, and someone asked again about the fee schedule um, with Planned Parenthood. And again, it just depends on the individual's unique circumstances. But yes, they offer sliding scale for pay. But again, I do not work at Planned Parenthood, so you can't necessarily quote me on all of that. But to my understanding, that's how it works. And someone asked, have you observed a difference in healthcare access with Medicaid expansion? Um, if I had to be honest, I would say no. Perhaps it's different in other places, but I think getting a um getting a behind the curtain, having a behind the curtains conversation with the healthcare provider. I think sometimes the general population doesn't understand that their every doctor or healthcare provider does not have to accept Medicare and Medicaid. And so because of that, because they don't have to accept it in the first place, and or there are ways that you can put caps on how many Medicaid and Medicare patients that you have. you can be in a place with plenty of providers, but if the providers in your area are full or not accepting patients or not accepting patients with a certain type of insurance, then that's not as helpful for the individual patients or the community members. Um, that's something that's frustrating. I hope our country can find ways to do better with that, but that's just how it is right now. I'm not sure, um, uh, LaShonda, if you had anything to add related to that from your perspective, but from what I see, um, not recently, there have been instances, and that's how and why I learned a little bit more about other resources. Because if Glenn Mead, which is one of our primary OBGYN providers in the area isn't currently accepting Medicaid patients, then where exactly do they go here in Wilmington? And so people are having to expand the radius of potential providers that they go to. And that's just to even have simple conversations about uterine fibroids or things like that. So you're not delivering a baby. It might be beyond the scope of your primary care doctor, but if a provider isn't accepting your insurance, then you can't see them.
Well, thank you for allowing me the opportunity to chime in um, on your discussion. But I mean, we have been fortunate enough to say here in our community, although we don't have the amount of providers that are accepting Medicaid, because there are some that do accept Medicaid in the state of North Carolina. The Department of Health and Human Services did report that there are an abundance of more prescriptions that are being filled. So people that need access to chronic disease management. For those individuals who have a diagnosis of HIV, there are no out-of-pocket copay costs for their prescriptions. So that is no longer a barrier to their life-saving medications. Those individuals that did need connection to medication assisted treatment for opioid use disorders, they now have access to care. So there has been a report of decrease in accidental overdose. So I would say broadly, there have been some advances in some clinical outcomes that we can access this data through the Department of Health and Human Services, right? But just imagine if we had more providers that accepted Medicaid. Unfortunately, there were some practices when they heard of Medicaid expansion, they actually just closed their doors to receiving Medicaid recipients. But if things were different, we would probably and even way more outcomes. But those reports are promising and encouraging. And with that knowledge, hopefully, we can continue to advocate for continuance of Medicaid in our state.
I agree. And then to add on to that conversation, because I'm not sure again if, a lot of the general public knows, but not too long ago, our government was trying to stop coverage for virtual visits. So that is what has allowed Medicaid expansion to work, actually, especially from our local standpoint, is because I could tell people, hey, give this provider in Raleigh or Fayetteville or whatever a call, because once you establish, much of what we do is following up on lab work or having verbal conversations and not necessarily needing to see people in person. And so if at least you can get established with some, and that's especially for like mental health um services as well, and like you said, assistance with substance abuse, because again, you can check the labs no matter where you are, as long as you're in the same state, you're good to go with prescription management and stuff like that. So I'm grateful too, but I'm also saddened when I hear people say they've basically called every practice in our city and haven't been able to get an appointment. So yes, I guess that was more from like an anecdotal standpoint, but I'm grateful and happy to hear that, statistically overall things are better. Yes, I'll send it back to you, Christian.
Yeah. Thank you for such a meaningful conversation, Dr. Foreman, and thank you everyone for attending the webinar this evening. We encourage everyone to sign up for SoTime, follow us on Facebook and Instagram for more updates on upcoming webinars, and join our mailing list for future updates. You can stay connected with SoTime on Facebook, Instagram, YouTube, and our website is www.seedsofhealingincorporated.org. Thank you and good night, everyone.
Good night.